Randall Senator the Honorable Randall Mitchell, Minister of Tourism, Trinidad and Tobago, Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health of Trinidad and Tobago, Mr. Frank Comito, CEO and Director General of the Caribbean Hotel and Tourism Association, Mr. Neil Walters, Acting Secretary General of the Caribbean Tourism Organization, Dr. Indar, our Director of Surveillance, Disease Prevention and Control, and your Master of Ceremonies for this event, Dr. Mark Sami, Director of Corporate Services of the Caribbean Public Health Agency, Mr. Ian Horseshoe, Senior Health Specialist of the Inter-American Bank, Trinidad and Tobago Division, Mr. Dudanath Ramkasoon, Chief Operating Officer of the Trinidad and Tobago Cricket Board representing the West Indies Cricket Board, other specially invited guests, Zoom participants, members of the media, ladies and gentlemen. When the Tourism and Health Program was created in 2014, it was one of the new innovative programs of CARPHA, created to respond to the health threats impacting negatively on the greatest driver of the Caribbean economy. In the intervening years, the THP has been evolving to better serve the region, fulfill its mission to improve the overall health profile of the tourism product, while gaining the national and regional political approval necessary to maintain the program. Now in 2020, the THP's moment has arrived. In the midst of this global pandemic, when travel and tourism have all but stopped, I am proud to know that the THP is helping to light the way back to economic recovery for our beautiful corner of the world. The Caribbean region has sacrificed so much to preserve the lives of our populations, while the heads of government have led an all of society approach to learning how to live safely with COVID-19. As one of the most tourism-dependent regions in the world, that must include a safe return to economic activity through a safe return to tourism. So CARPHA has built a suite of measures on the foundation of the THP, which include a real-time monitoring and response system, guidelines for COVID-19 health measures, and training in these guidelines and protocols, operational health and environmental standards, and today, we launched the Caribbean Travelers Health Assurance Stamp for healthier, safer tourism, and the Caribbean Travelers Health mobile app as CARPHA's contribution to the regional armor to mitigate the impact of COVID-19. These are Caribbean regional public goods, which are crucial for preparing the hospitality sector to respond to COVID-19 in 2020 and other public health threats as they develop in the future. CARPHA extends sincere thanks to its partners in this unique venture, the Caribbean Tourism Organization, the Caribbean Hotel and Tourism Association, the Global Tourism Resilience and Crisis Management Center, for consistently supporting the need to make tourism healthier and in the COVID-19 times, safer and healthier. So CARPHA comes together with our partners to contribute to rebuilding tourism and embracing economic recovery in the Caribbean, a region that has been severely impacted by COVID-19. I invite you to listen, watch, and learn how we have been working together to be strong in tourism together. I thank you.
Thank you, Dr. Joyce and John, for providing the CARPHA's perspective on not just our regional response, but the THP's specific response for returning to safe and healthy travel during COVID times. We would now like to move on in this agenda to bringing some perspectives from our partners. Health and tourism partnerships is crucial for healthier and safer tourism, especially during COVID-19, when travelers are demanding a healthier, safer destination. CARPHA is a global pioneer in health and tourism partnerships. The THP, or the Travelers Health Program, is a key outcome of a unique partnership established 6 years ago with the Caribbean Tourism Organization and the Caribbean Hotel and Tourism Association, and then later on, 2 years ago, with the Global Tourism Resilience and Crisis Management Center, all of which are the region's premier tourism bodies. This partnerships bridges that collaboration between health and tourism authorities aimed at safeguarding the health of travelers, employees in the hospitality industry, as well as our local population. Earlier this year, in March, CARPHA partnered with CTO, CHTA, and the GTR CMC, and the Organization of the Eastern Caribbean States Commission to form the COVID-19 Tourism Task Force to launch COVID-19 health safety and sanitation guidelines and training. And today we have trained, up to date, we have trained over 4,000 persons. We will now like to hear by Zoom from Mr. Franco Mito, the CEO and Director General of the Caribbean Hotel and Tourism Association.
Good morning. Protocol has been established. Thank you to Dr. Indar and Dr. St. John and the entire CARPHA team for the proactive role you've been playing with the Caribbean Hotel and Tourism Association and the tourism industry to help ensure the health safety of our visitors, employees, and residents. Ours is indeed a unique partnership between health and tourism, which started more than 5 years ago. And the value of that ongoing collaboration is becoming most evident today as we've worked together to mitigate the impact of COVID-19. Collectively, we are making every effort toward providing assurances to our visitors that they can travel to the Caribbean with confidence and are able to enjoy the incredible offerings which our region provides. Several weeks ago, Travel Council, a leading global travel research firm, completed a survey of travel agents and travel partners in which they asked what are their clients' top 3 considerations when considering a destination today. Overwhelmingly, 74% cited having a destination health safety certification as their top consideration, and we're going to learn more about that this morning. The second highest consideration from 60% of the respondents was with knowing and agreeing with the destination's management of the COVID-19 pandemic. So getting that communication and information and assurance that a destination is indeed handling health safety matters effectively. Clearly, health safety is top of mind by travelers and when shopping for and choosing a travel destination. So the tools CARPHA is sharing with you today underpin our industry's health safety efforts. These are being supported as well by a rigorous training effort of thousands of employees since June, drawing upon one of the world's most comprehensive sets of health safety protocols, guidelines, and checklists developed collaboratively by tourism and health officials. As travelers seek to escape to the Caribbean to recover from the stress and strains of the pandemic, they too can help accelerate our economic recovery and reopen our businesses and re-engage our employees who hunger for the opportunity to provide that legendary Caribbean hospitality by planning a wellness escape, if you will, to the Caribbean with assurance that through the initiatives being shared with you today by CARPHA and the health safety commitment of our industry, they can travel with confidence. Thank you.
Thank you very much, Mr. Franco Mito. I would now like to introduce Mr. Neil Walters, the Acting Secretary General of the Caribbean Tourism Organization, to bring remarks.
Good morning. Thank you to Dr. Indar. Protocol already being established. I also want to say thank you generally to CARPHA and all of the partners which have collaborated to bring this very, very important action to fruition. As the Caribbean. the Caribbean Tourism Organization is pleased to be associated with CARPHA in a relationship which goes back more than 6 years, during which time we have collaborated on matters related to various health events which affected tourism in the region. I refer here to events such as the Zika and chikungunya outbreaks over the last decade. The COVID-19 pandemic has brought more sharply into focus the need for a strong collaboration between tourism and health globally. And here in the Caribbean, we have that collaboration, as Dr. Indar just mentioned. We are actually forging ahead of the rest of the world. And that collaboration has been forged through many years of cooperation to ensure the health of our residents and visitors alike. We have made great strides as tourism and health sectors to bring into existence the protocols and guidelines you mentioned before to ensure the health of our residents and visitors as we have reopened to international travel in the face of this pandemic. The CTO endorses the Caribbean Travelers Health Assurance Stamp and the mobile app. These tools, which are part of the overall tourism and health program, are key mechanisms to ensure that potential travelers to the region can be assured of their health as they plan travel to the region. As the Caribbean is the most tourism dependent region, actions like this one show that we are a responsible destination. We are creating an oasis of health and safety in the face of this international crisis. The program also assists the region to respond to what has been and is expected to continue to be a very dynamic period through monitoring and ultimately allowing us to adapt to this dynamic environment. Our resilience as a region is well known and strengthened by collaborative efforts such as this one, as we work together to mitigate the negative impact of COVID, which it has wrought on tourism and all of our productive sectors. I thank you.
Thank you very much, Mr. Walters. The THP and this unique COVID task force and partnership is really forging ahead in terms of our safe return to tourism apart from the rest of the world. As we continue, we now present a video from the Global Tourism Resilience Force, our newest partner, given by the Honorable Edmund Bartlett, the Minister of Tourism from Jamaica and co-founder of the GTR CMC.
A healthy and safe tourism is key for a resilient industry, especially one that the Caribbean relies on heavily. This need for a healthy and safe tourism has become even more crucial as the world grapples to collaborate to find solutions in another global pandemic. However, we cannot achieve this on our own and must get the best minds and partnerships to do so. Recognizing the importance of harmonized regional measures, I launched the Jamaica Tourism and Health Initiative in 2015. In 2018, I was instrumental in building dialogue between CARPHA and the UNWTO. Today, CARPHA is a UNWTO affiliate member because of its innovative work in sustainable tourism. As co-chair and founder of the Global Tourism Resilience and Crisis Management Center, I have also developed a partnership with CARPHA's Regional Tourism and Health Program, the COVID-19 Tourism Task Force, for promoting health and safety measures for travelers to the Caribbean. I want to therefore commend CARPHA for its innovative leadership in establishing a novel measurable health assurance stamp and other tools that will not only build travelers' confidence in the Caribbean, but build destination assurance. Travelers' Health Stamp is supported by the WTTC and the GTRCMC and complements the work of our recently launched Jamaica Cares. Together, we're making the Caribbean healthy.
Thank you, Minister Bartlett, and unfortunately, he could not be with us today, but he has been part of our tourism and health program almost from the inception, supporting its work. And finally, we bring you endorsement from the World Travel Tourism Council. This endorsement comes from Ms. Gloria, the CEO of the World Travelers Tourism Council. And it says, the World Travel and Tourism Council commends the Caribbean Public Health Agency and its partners, the Caribbean Hotel and Tourism Association and the Caribbean Tourism Organization for its unique partnership between health and tourism and their growing commitment to the health and safety of travelers and residents. We support the CARPHA CTO CHT Travel Health Assurance Stamp as an additional and measurable health assurance stamp for the Caribbean. We welcome the participation of the region's tourism industry stakeholders in both the WTCC Safe Travel Stamp and the CARPHA Travel Health Assurance Stamp. By working together locally, regionally, and globally, we will succeed in building traveler confidence and accelerating tourism's recovery. Ms. Gloria Guevara, CEO of the WTCC. So switching gears now, the time has come to introduce you to one of our first innovative tools, the Caribbean Travelers Health Assurance Stamp for Healthier, Safer Tourism. This is a recognition award for all tourism entities and destinations which are recommended the proactive COVID-19 health monitoring and safety measures, such as the use of the Tourism and Health Information System and participating in the COVID-19 health measures for reopening tourism. Caribbean travelers have the added assurance of a healthier and safer option for accommodation and services who have been awarded this stamp. The stamp has been officially approved by the CTO, CHTA, the Global Tourism Resilience Task Force, and endorsed by the WTCC. Hospitality facilities that are awarded the stamp will be globally publicized as a preferred and a healthier option on the Caribbean Travelers Health mobile app. This unique stamp is unlike any other safe travel stamp in that it is measurable and it is verifiable. The Healthier, Safer Tourism Stamp is the defining moment to safe reopening of tourism in this region. I now give you the Caribbean Travelers Health Assurance Stamp for Healthier, Safer Tourism.
Travelers now have the added assurance of a healthier, safer option when coming to the Caribbean.
The Caribbean is paradise. You know, we've got lovely people, wonderful cuisine, beautiful beaches, and most importantly, a rich history of Caribbean flavor.
CARPHA, the Caribbean Public Health Agency, is committed to promoting the health and safety of travelers coming to the Caribbean through its novel Travelers Health Program. It allows for real-time monitoring and response of public health issues, supported by training and health, safety, and sanitation standards for our hospitality community. It also provides a measurable Caribbean Travelers Health Assurance Award stamp to hotels and guest houses that are implementing proactive health monitoring and safety measures. Facilities with the stamp are identified on our Caribbean Traveler Health app as a preferred, safer option.
We don't only have the best cricket, but healthy and safe environment.
There is no better time than now for us to work together to ensure that the Caribbean is globally acknowledged for its healthier, safer tourism.
The aim of this program is to improve and enhance the well-being of both our visitor and our local population.
CARPHA, promoting healthier, safer tourism.
Thank you very much. So if the West Indies players tell you it's safe, well, I'm sure you have an assurance that it is safe. And to tell you how to get this stamp, we produce now this instructional video. So we urge every tourism facility to get the stamp, whether you're a hotel, a guest house, an Airbnb, a destination or a tour operator, or a taxi association. Get the stamp for healthier, safer tourism. We are now moving on to another section in our program, where we will hear about the importance of this traveler's health stamp to health surveillance and response. I now invite Dr. Roshan Parasram, the Chief Medical Officer of Trinidad and Tobago, to bring remarks.
Hi, good morning and greetings from Trinidad and Tobago, all protocols observed. Thank you for this opportunity to speak at the launch of this very noteworthy undertaking by the Caribbean Public Health Agency and all partner agencies. Let me first take the opportunity to congratulate CARPHA for the proactive steps taken to identify the need for the Caribbean Travelers Health Assurance Stamp for healthier, safer tourism and the Caribbean Travelers Health mobile app. These initiatives will go a long way inspiring the confidence of potential travelers and facilitating safe travel, while boosting the regional tourism market against the backdrop of global COVID-19 pandemic. The development of Health Assurance Stamp and the app is quite timely, especially when one considers that many countries within the region derive most of their national income from tourism. In terms of the benefit to health, this is the point at which sustainable tourism and regional health security overlap and integrate. These two initiatives will form part of the strategies employed to Caribbean countries to reduce overall risk and to contain the disease. Initiatives such as these do not only affect tourism sector directly, but also public health and overall national development. While it is accepted that economic activity must be reignited, it is clear that a new blueprint is required for safe tourism activities. Those of us in health are pleased to partner with the tourism sector, as by reducing the risk of transmission of COVID-19 from visitor arrivals, we ultimately reduce the burden of healthcare workers and on existing health resources. For most Caribbean countries, the domestic health system would not be able to cope with a significant surge in COVID-19 cases brought into the country from external travelers. Currently, Trinidad and Tobago is experiencing approximately a 10% COVID-19 positivity rate for returning nationals from certain jurisdictions. This is carefully managed a system of repatriation, which is based on the availability of facilities for quarantine and isolation. When borders are reopened, the initiative launched today will become a very effective tool for COVID-19 management in Trinidad and Tobago, as I expect it will be for other countries who have already opened their borders to external travelers. The real-time provision of information that is inherent with application of technology and the collaborative approach to the implementation of this Caribbean-wide project are two key factors in the success of the holistic management of a viral pandemic. I have much hope for the success of this project, as we are all poised to benefit. Pragmatically, it allows us to detect diseases earlier, thereby ensuring WHO's cornerstones of outbreak control are met: test, isolate, and treat. In closing, I would like to express my pleasure at being present to participate in this launch. I congratulate CARPHA on not just the creation of these tools and the timeliness of their introduction, but also for leading by example and demonstrating that we can find a way to conduct business successfully and live positively within the new normal. As I said a few weeks ago, COVID-19 will do for public health what 9/11 has done for global security. I thank you for your attention and wish CARPHA a successful launch. Thank you, Dr. Indar.
Thank you, Dr. Parasram. It has indeed been a pleasure working with you over the last 3 years as the head of the Trinidad and Tobago Steering Committee for Tourism and Health, and more so in the past few months as we work together to mitigate COVID-19 and other health threats. So we are now again switching in our program to move over to service provider testimonials. We want to be able to highlight the benefits of these new initiatives to our key stakeholders, that is the hospitality industry. The adoption and the use of these tools by the hospitality sector is crucial to enhance visitor and local health and safety and towards building travelers' confidence and reinstating travel in the Caribbean. Today, we are especially privileged to share with you testimonials from Mr. Adam Stewart, the Deputy Chairman of the Caribbean-based resort company, Sandal Resort International, which includes some of the travel's most viable brands, and Mr. Olivier Maumer on behalf of the Hilton Hotel Trinidad and Tobago.
There is no question that 2020 has been a very difficult year. The Caribbean is the world's most tourism-dependent region in the world, and its effect on hospitality right here in the Caribbean has been decimating. On the recovery, as we reassemble the infrastructure of tourism, one of the most important features is to give confidence to not only the team members of our resorts and its great industry, but also to our customers worldwide. The Caribbean Travelers Health Assurance Stamp is a critical feature. I'm proud to be here today representing Sandals Resorts International, joining forces with the CTO, the CHTA, and the many other associations that are endorsing this program. Sandals Resorts right now is currently training all of our team members. And I want to endorse this program and encourage all other hoteliers to get on board and be a part of keeping the Caribbean safer and healthier. I also want to congratulate Dr. Lisa Indar and her entire team at CARPHA for their outstanding innovation and their commitment to keeping us all safe down here in the Caribbean. The Caribbean is one of the most resilient regions of the world, and we will build back stronger. Congratulations, Lisa and team.
Good morning to all. My name is Olivier Momer. I am the General Manager at the Hilton Trinidad and Conference Center. COVID-19 has brought to our industry some unprecedented challenges and placed our industry as one of the most affected. As a Hilton hotel, we have one of the most comprehensive and well-received preventive programs in our industry, that is Clean Stay by Hilton. So our hotel is fully prepared, but the anxiety to travel and stay in a hotel in safe conditions is unfortunately greater than the desire for the experience of traveling again. I strongly believe that people will come back to connect, discover, and experience in person because it is who we are. We just need to rebuild the assurance our guests need. As such, we support CARPHA for their great initiative in creating this opportunity to bring back some confidence again for our travelers. Thank you very much. Stay safe.
Thank you very much, Adam and Mr. Olivier, as we continue to work with our tourism sector for reinstating travel. We have about 250 persons online, and I urge those of you all who haven't yet, joined to join and learn about these exciting tools. So I'm really excited to introduce our second feature for today, the Caribbean Travelers Health app. This was developed by TouVisCon of the United Kingdom, but it connects the Caribbean globally with all our travelers. This Caribbean Travelers Health mobile app is a unique, multifaceted health information repository It is designed for the travelers as well as the health and the tourism stakeholders. It provides travel information by each Caribbean destination, including vaccination requirements and healthcare facilities, accommodation listings, health alerts to the current public health issues, COVID-19 proactive and prevention measures, and the travel requirements by countries, which is especially important now as countries open their border. It links directly to CARPHA's COVID-19 situation reports and guidelines, and of course, the Tourism and Health Program. The app also identifies accommodations and other hospitality facilities within a destination that has been awarded the Caribbean Travelers Health Stamp. So it's your free marketing. It also has evolved in response to the COVID-19 pandemic. CARPHA is uniquely resourced and positioned to provide reliable travelers' health information of this detail and magnitude. The app is available on both iOS and Android platforms. I now present to you the Caribbean Travelers Health app. So there you have it, folks, the Travelers Health app. Isn't it exciting? Well, I'm very excited about it. It is not just for our tourism providers, but it is for the travelers themselves. And see the link in our chat box that we will put on for both the Google Play and the App Store. It's ready, it's live, it's free, so download it now. So finally, we move on to the last of our endorsements, our special stakeholder endorsement. Caribbean tourism is not just about the sun, sand, and sea. Yes, folks, it's more. It's about our rich and varied culture, our cuisine, and our sports. In the past few months, we have been partnering with the West Indies Cricket Board to ensure safe return to sports tourism. We are especially fortunate to present to you the endorsement from Mr. Richard Skerritt, the president of the West Indies Cricket Board.
The Caribbean is a great place to live, and thanks to the Caribbean Public Health Agency, CARPHA, the Caribbean will continue to be a truly safe place to visit. During this challenging period, CARPHA has helped Cricket West Indies to keep all cricketers tested, well-informed, and ready to go to work. Together, CWI and CARPHA will ensure that it won't be long before cricket tourism can be up and running again in our region. Next year should be an exciting year for West Indies cricket, and we invite travelers to start planning to visit the Caribbean, a great place to live and a truly safe place to visit.
Thank you, Mr. Scarrett. And as you saw, we saw two of our most prominent regions cricketers in the video. And finally, funding is key to achieving these state-of-the-art outputs. The Inter-American Development Bank, IDB, has been funding the THP initiatives since its inception, as we work together to develop novel regional public health goods to promote sustainable tourism and economic growth in the region. Our focal point, Mr. Ian Horseshoe, Senior Technical Health Specialist from Trinidad and Tobago, is now an honorary team member, working with us every step of the way. I now invite Mr. Horseshoe to bring remarks.
Good morning, all protocols observed. For over 2 decades, the IDB and CARPHA have worked together with a shared commitment to improving public health and the overall well-being of the Caribbean people. In the spirit of this partnership, in 2015, the IDB approved the funding for the Regional Tourism Health Information Monitoring and Response Systems and Standards to Enhance Sustainable Tourism Project. Yes, it's about a mouthful. And the project was to protect the health and wellness of both our Caribbean populations, as well as the millions of tourists that visit our shores every year. Since its kickoff, the project has successfully achieved several key results. So much so that in 2018, a project phase 2 was approved by the IDB. The IDB is very proud of this project and even prouder to be part of today's launch. The Caribbean Travelers Health Assurance Stamp and mobile app were both developed under the IDB funded project, and both these products could not be timelier given the current difficulties posed to the Caribbean tourism by the COVID-19 pandemic. The IDB is confident that both of these innovative tools will provide solid support to allow Caribbean countries to fully reopen their borders for our visitors. In closing, it would be remiss of me if I did not recognize all the hard, tireless work that Dr. Lisa Indar and the committee team at CARPHA has put in to get us to this point. We at the IDB think of CARPHA as more than just an executing agency for the project, but rather a good friend and a long-standing and reliable public health partner. And we look forward to future public health collaborations. Thank you.
Thank you, Mr. Horseshoe. We remember those kind words when you are demanding the many reports. And now we want to change gears to our last feature for this launch, to look at the tourism tourism perspectives and to re-emphasize the importance of this health assurance stamp and mobile app for healthier, safer return to tourism. I now invite the Minister of Tourism, Culture and the Arts, the Senator, the Honorable Randall Mitchell.
Thank you, Lisa. All protocols already having been observed, to the industry stakeholders and observers joining us here and virtually, members of the media, good morning. Today, it is indeed my pleasure to deliver remarks at what is a significant step in the fight against the spread of COVID-19 and in preparation for a post-pandemic reality. Apart from the core health sector, the travel and tourism industry was the first to be impacted, has suffered the greatest, and will also be among the last to recover. There is no need here to highlight references to GDP or other numbers. It is a self-evident truth. The sector has been devastated. Within that recovery process, the Caribbean Travelers Health Assurance Stamp and the Caribbean Travelers Health App will be key tools to ensure that visitors to Trinidad and Tobago and the wider Caribbean find comfort in the knowledge that our destinations are safe and healthy spaces. This means that in our new normal, we must offer assurances that visitors' health and safety are paramount. Here in Trinidad and Tobago, we understand this, and the tourism, culture, and arts sectors are working with the Ministry of Health, CARPHA, and other relevant agencies to develop and roll out comprehensive plans for all our stakeholders. To date, the Ministry of Health has produced several health and safety guidelines to guide the reopening of the economy, particularly for places often frequented by travelers. More so, our two international airports, Piarco and the ANR Robinson International, have already achieved accreditation through the Airport Council International and the Airport Health Accreditation Program. Stakeholders are being trained, and we are confident that they will be able to display CARPHA's Traveler's Health Assurance stamp and be listed on the Health Assurance app. As you're aware, Trinidad and Tobago's early response to this pandemic was lauded internationally, but this would not have been possible without the support of CARPHA, our CMO and local public health agencies, Tourism Trinidad Limited, the Tobago Tourism Agency, the Airports Authority of Trinidad and Tobago, and our many stakeholders. This health and safety intervention by CARPHA will position Trinidad and Tobago and the rest of the region as open for business and underscores our commitment to the health and safety of our travelers. CARPHA's persistence in the continued development of safety systems in our tourism sector and its foresight in the development and launch of the Caribbean Travelers Health Assurance Stamp and the Caribbean Travelers Health App must be commended. We at the Ministry of Tourism, Culture and the Arts stand ready to continue to endorse and support these efforts as we navigate this pandemic and prepare our destinations for post-COVID reality. I thank you.
Thank you very much, Minister, in emphasizing the importance of these tools to reinstate safe and healthy travel to the Caribbean. Ladies and gentlemen, we are almost to the end of this milestone, auspicious, and if I may add, exciting event. I want to welcome our epidemiologist, the tourism and health epidemiologist, Ms. Unella Cyrus, to give the vote of thanks.
Good morning to all. No duty is more urgent than returning of thanks. On behalf of Dr. Joy St. John, Dr. Indar and the executive management of CARPHA and the entire COVID-19 task force, I wish to extend a very hearty thank you to Senator the Honorable Randall Mitchell, Minister of Tourism, Culture and the Arts, Dr. Roshan Parasram, CMO, Trinidad and Tobago Ministry of Health, Mr. Ian Horseshoe, Senior Health Specialist, Inter-American Development Bank, and Mr. Olivier Mormer, our gracious host, General Manager of Hilton, for your contributions and words of encouragement. Your very presence here today from your busy schedules is a reflection of the importance of this tourism and health event. Our sincerest gratitudes also go out to our other supporting agencies and partners, including CHTA, CTO, the Minister of Tourism, the GTR, CMC, the WTTC, Sandals, and the board and management of the West Indies Cricket Board. Your endorsements and testimonials demonstrate that the THP program has an integral role to play for all CARPHA member states. We also extend a special thanks to all of our viewing public, including the media of this virtual launch. We appreciate your unwavering support, especially to those who have participated in our weekly webinars. An event like this does not happen overnight, and we wish to thank all of our CARPHA staff and our third parties who have worked feverishly in organizing this event. But I must make special mention of our deep sense of appreciation to Dr. Indar for her pioneering efforts and commitment to steering this THP ship. This THP event demonstrates that as a region, we are equipped and ready to mitigate against all health risks, especially those posed by this COVID-19 pandemic. So on closing, I thank you all again for attending today's launch. It's been a pleasure to wind up these proceedings. Thank you very much.
Thank you very much, Unella. and it will really be remiss of me to not to mention, the unwavering and persistent, as well as the passionate support from my team that we have here, Ms. Saris and Ms. Mohammed and Ms. Sasti and others who are not with us. These lovely video infographics, animated videos that you're seeing were developed in-house. So in addition to all the other work that we do. So thank you again all for being with us this morning. It was my absolute pleasure to be your moderator. I hope I have excited you on this new level of tourism, health, and safety. Members of the media and others, you're invited to stay on for the live 30-minute question and answer session that will start in 5 minutes. A gentle reminder for media houses to state the name of your media house. As we acknowledge the departure of the Chief Medical Officer and the Minister of Tourism, we want to leave you with this video of simple ways you can prevent COVID-19. Welcome back, everyone, now to the question and answer session. You're reminded that if you do have a question and you place it in the question and answer box, you would be upgraded when you're ready to panelists, and then you can raise your hands. If you raise your hands first, you will be upgraded to panelists, and your question will be answered. On this session, we have with us the director of CARPHA, the executive director of CARPHA, Dr. Joy St. John, the CEO of the CHTA, Mr. Franco Mito, the acting secretary general of the CTO, Mr. Neil Walters, myself, Dr. Lisa Indar, and our technical epidemiologist, Ms. Unella Cyrus. So we would move on now to our first question.
Okay, I see that we have a raised hand from Lachman Julian, so you will be invited to ask your question live now. Julian, can you put on your video and ask your question? Can you please unmute your mic as well? Okay, so we're gonna keep going. I see Mr. Louis Romaine. Your hand is raised. Kindly go ahead. You'll be asked to unmute your mic and put on your camera and ask your question.
All right, good morning to all. My name is Louis Romaine from Dominica, a member of the Nature Island Taxi Association, acronym NETA, and also Combined Taxi Incorporated. I provide special services, especially in the cruise industry, wheelchair accessible services. I want to, first of all, commend CARPHA and the other stakeholders in hosting this very vital launch and sharing that information with us. I want to congratulate you and thanks so much for all the presenters who did a wonderful job. My question is in the obtaining of the assurance stamp. You gave out some information earlier. I wanted to know if that information is in the correspondence you sent to us, or if we can get that information through, of course, with the email or the form. I think it is very vital to know, of course, these steps and probably have it written down so we can be sure that we have that, sorted out. So basically the question is about having the assurance stamp, the steps that has to be taken in getting that stamp. Thank you very much.
Yes, they are.
Okay, so I can have that question. All the information regarding obtaining the stamp is available on our website. It's this.carpha.org/THP. On the left-hand side of that particular website, you will see specific tabs labeled with each one of our different components. So you will see a tab for the Healthier, Safer Tourism stamp. Under that tab, you will see an infographic with the instructions to obtaining the stamp and any other infographics we have related to the stamp, the links to the videos, etc. So all that information that you require to try and go through the process of obtaining it is available online. Based on the countries that you're from, we would have current participating THP countries. Those countries will be sending out emails to their stakeholders in their countries, so you would receive that information from them as well. But if you are currently in a country that's not a THP participating country, please visit our website for all further information. We see another hand raised, Mr. Kadeem Joseph.
Good morning.
If we can't get your
here we
audio
are.
playing, kindly put your
Good morning.
question in the box. I will read out a couple of the questions we would have had in our chat during the webinar. Oh, Mr. Joseph, can you ask a question? You're on.
Yes, good morning. Thank you so much for having me and for giving such a comprehensive report on the product that you're producing and have now ruled out. Given that a part of our tourism product is intra-regional travel, could you give any indication how this would impact intra-regional travel, especially given the issues that we're now seeing with the travel bubble that has been implemented across CARICOM? What are the additional benefits, if any, for intra-regional travel specifically? Thank you.
I'm going to ask our Executive Director, Dr. St. John, to take a stab at that first and invite either Frank or Mr. Walters to follow up.
Thanks very much, Ornella. So Kadeem, thanks for that question. And the whole thing about this stamp is that it is in stages that you can get different gradations of the stamp. And it's all about making sure that the traveler and visitor, even if it is an inter-regional traveler or visitor, has a sense of security when they are visiting a facility. So it is supposed to enhance travel in these COVID times and the sense of security. And the thing about the stamp is that the CARPHA THP program is going to be ensuring that certain requirements are met and tracking this. So it is not just a stamp for a stamp's sake. It's also going to be a stamp that ensures that certain measures are in place. In terms of the tourism bubble, the CARICOM bubble, CARPHA was mandated to give additional information to the heads of government, which we have, and we are awaiting a response from CARICOM on if those measures will be agreed to. But you have heard several prime ministers give their opinions about the bubble, and also, and CARPHA is really happy about this, also signal that they will be implementing the use of PCR testing from an approved laboratory as a measure of reducing risk in travel in the CARICOM region. So I must say that although there's been an evolution of the bubble because of some issues, I like the way in which the heads of government are ensuring that they reduce risk of travel within this region. Over.
Okay. At this point, I see no more hands raised for live questions. So I will address a couple of the questions we have in the Q&A box. Mr. Rashad Khan asked, well, this would have been for Dr. Parasram, but he has left. If the app and the program would be considered for implementation in Trinidad and Tobago as discussions continue around the reopening of our borders. While we cannot speak to any decisions made on reopening our borders, we can say that Trinidad and Tobago both have their own tourism and health steering committees. And as part of them implementing the program on both islands, they will be adopting the app as well as the stamp. So it is going to be integrated into our current protocols and procedures on both islands. We also have a question here in terms of a follow-up about the actual steps for accessing the stamp. So the infographic that is available on the website states that you are required to participate in one of our Tourism 101 guidelines for reopening tourism training sessions. Once you finish that particular training session, you will receive a certificate of participation. That's step one. Then you are asked to register for our tourism and health information system. and be registering on that platform for at least 4 weeks, after which you will receive an email alerting you that you have qualified for receiving the stamp. In that email, you will also get a digital logo of the Healthier, Safer Tourism stamp that you can use for your own marketing, etc. And after that point, you will be listed on our Tourism and Health app under the Healthier, Safer Tourism tile. So when persons visit the app, they will see you listed as a healthier, safer destination. We ask at this point if anyone else has any live questions. Please raise your hand so that we can address them. Okay, well, we see no other live pressing questions. So we ask that if you have any other queries that you contact either myself or Ms. Mohammed. Oh, we have one more question. Mr. Arun Singh, kindly unmute your mic and go ahead with your live question. Okay, Ms. Cambridge. Okay, so if anyone else has any further questions, we invite you to contact us via email. The relevant email addresses will be put into the chat, so you can forward any of your further queries to either myself or Ms. Mohammed, and we will try to get back to you as soon as possible. Okay, so at this point, we would thank you for joining today's proceedings. We ask if any of our tourism stakeholders online have any closing remarks to make, can make them now before we sign off.
If I may.
Sure, Frank, go ahead.
Sure. I noticed in the Q&A there were a number of questions about liability and how businesses protect themselves regarding that. We did, a couple of months ago, we did a very extensive webinar on liability waivers and how to handle that, because it's really important. While we are providing assurances here, we can't provide any guarantees because there are so many ways in which people can catch COVID-19, but we can help to, and what we are doing is providing assurances that we're doing everything possible to help mitigate. But that still leaves open the question of liability, which concerns some of our industry stakeholders and should. There are protocols and procedures that every business should go through to provide liability waivers throughout every aspect of their communications. And on their websites, in their communications with guests, at check-in counters. I mean, there's on booking forms, on just a variety of points of contact or interaction with a potential visitor or a visitor. In that webinar, we give some very comprehensive guidance. We had legal expertise as well involved in it on how to address liability, what language you should be using or considering. We give tools and examples of those kinds of things. So you can access that. I will provide that information for the information that CARPHA will respond to and follow up with on the various Q&As that are here. But we'll give you access, the link through our website to our COVID-19 Resource Center, where we have that and many other webinars recorded, and you can draw down that information. Thank you.
Okay, thanks a lot, Frank. We do see one more question from Dr. Shamdeo Prasad out of Guyana. And Shamdeo asked if the stamp will be defined for a particular period with renewal conditions and a timeline. And will there be a provisional level of the stamp for operators who don't meet all of the requirements that we stipulated? And I'll ask Dr. Indar to take this question.
Thank you, Onella. Yes, the stamp is for a period. Given that it's a verifiable and measurable stamp, we will be monitoring on a weekly basis, the reporting and the fact that persons have had a certificate of participation. So initially, if all that is, if you have achieved all those different requirements, the stamp is valid for a year. And of course, following that year, you would be able to reapply for the stamp. In terms of small, medium, and large facilities, there are different requirements. We do have the considerations, and that is tabled based on the size of your entity. And again, the stamp is available not just for a hotel, but a guest house, as well as, tour operator, taxi association. And it's based on the practices as well as using the tourism and health information system. And while we're on using means, if you have 0 cases, you also report that, because that's a form of report.
Okay, thanks a lot, Dr. Indar. I see a question in the Q&A box from Brian Lewis, and he's asking if sport organizations who bid for events can be part of the program. What I can say, we have been looking at diversifying the persons that are allowed to participate in the tourism and health program. We would have initially started off with just cruise ships and hotels, but we've now added and included ground transportation companies as well as tour operators. So what I advise is that you contact us. We are looking to add more persons to our steering committees. Only if we have more representation on the steering committees will we better be able to, provide a service that can adapt to if it's a sports organization, or I saw quite a number of comments from the Yachting Association, etc. So please contact us so we can discuss how we can incorporate you into the program. Okay, I believe there is a live question from Ms. Cheryl Cambridge. Please unmute your mic and go ahead.
Can you hear me? Good morning.
Good morning, we can hear you.
Okay, Cheryl Cambridge from Cheryl Bahamas Taxi and Tours. I asked a question earlier, but I don't think you guys saw it. Are you guys teaching this in the schools for the kids? Because remember now, quite a bit of us, we are in the tourism business, and the teenagers, they're not behaving. They're having these wild parties and stuff. So are you teaching this in the schools, especially with the high school? Also, there's another question. What about mental health? Remember now, drivers have not worked for March, and even people in the tourism industry. And then you have guests coming in, because I have lately been bringing people in who are stressed out, coming here for vacation to get away from all the stress. And then you have drivers that have stress. And then, everyone's on edge. So what are we doing about mental health, dealing with the issue also, not just because I have done videos put on my website and on my Facebook page, letting them know that I've done the safety protocol compliance certificate with the Ministry of Health and Ministry of Tourism. And all of my staff, my greeters, my workers in the office, and my drivers. We have done all of that. And I've done videos to show my guests what we are doing. That's fine and dandy. But what about the mental health? What are we doing to address that?
Okay, thanks a lot, Ms. Cambridge. I would like to ask Dr. St. John to address that question for us, and maybe Lisa can finish up after.
So thank you for that question. I had spotted it in the chat. I think you put it in the chat and the Q&A. And yes, mental health issues surrounding COVID-19 are something that we've been monitoring. And it isn't just in the tourism sector that people are feeling the fallout of being forced to live in the way that Caribbean people don't like. We like to interact, we like to touch, we like to hug, we like to line. We like our family gatherings, we like our church. And there are mental health issues arising from that. There are also the mental health issues, as you pointed out, arising from the fact that people have lost their livelihoods or have had a slow in their income, and it is not easy. So what we at CARPHA have been doing in collaboration with our expert advisory group is looking at how we could actually quantify some of these issues in the service industry. Our staff and members of the EAG from PAHO have put forward a proposal where we would actually quantify that, because in our public health business, we get the best responses to our initiatives if we research on them. The other thing that we have been doing is also supporting PAHO in their initiatives to address the mental health issues. In terms of the teaching in the schools, I smile when I saw that option. And there have been outreaches through the education sector, but I'm not sure if Lisa has gone ahead to do a special program within THP that reaches out specifically to the young people. We are aware that the young people are partying, and some of the old young people are partying too. And some of this is COVID fatigue, but we are urging people to realize that the virus does not get tired, and the virus loves it when people are gathering and not being careful, not wearing their masks, not washing their hands, and not social distancing. So we have to take a rest and try being careful again. I think that I am going to hand it back to you, Ornella, so someone else can deal with the THP specific aspects to the question.
Okay, thanks a lot, Dr. St. John. Regarding us going into looking at maybe having some sort of component that addresses school-age children, that is something we can look at. I would have said before, we are always looking for ways to diversify the program and cater to the needs of the people. So we will definitely take that into consideration. I will hand over to Dr. Indar now for some closing remarks.
Okay, thank you very much for all those who have participated in this question and answer session. We are not seeing any more hands raised. If you do have any questions, please feel free to email us. We will answer anything that is posted. And of course, please feel free to go onto our website, and all that we would have said today and all our products will be posted on our website, including these animated videos, so that you can be able to use and distribute as you see fit. As we close, I would now like to invite our three directors, the director of CARPHA, the CEO of CTO, and the CEO of CHT to bring any final remarks.
Ladies first?
Ladies first, of course.
So I want to thank, first of all, Dr. Indar and her team for the fantastic launch. I know the behind the scenes work, and I am so proud of you. This has been a stellar event. I also wanted to thank our partners who are present with us and those who brought messages for the support, because you cannot do an initiative like this without going hand in hand with tourism. I would also like to thank the government of Trinidad and Tobago for their support generally and for their support within this launch. Incoming the minister and the CMO taking time out of their busy schedules to join us in this very important initiative. And I want to thank the participants and to thank them for their active involvement. And we will answer your questions. Trust me, I will make sure that Lisa does. We will answer your questions, which were all very good. So thanks again. It was wonderful to spend my morning in this way. Over to you, Lisa.
Thank you, Dr. St. John. Frank?
Sure. Thank you, Lisa and Dr. St. John. I just very quickly, I want to thank CARPHA and the team. They're an incredibly dedicated team. We've been watching their round-the-clock dedication to this since January, actually, when we all started getting involved in this. So we didn't jump into this later or try to hide it. We basically realized and recognized early, very early. And CARPHA educated us back in January. On January 28th, I believe it was, we had our first orientation session with the industry. And shortly thereafter had another one on February 4th with over 400 industry stakeholders. So our industry has taken this incredibly seriously. We recognize that the health and wealth of the Caribbean, of everybody in the Caribbean, is really dependent upon getting tourism back on its track, and the health safety is absolutely critical to doing that. And all of these tools and efforts and initiatives are just an indication of our collaborative commitment, and we will recover and we will rebound and faster and better because of this. Thank you.
Thank you very, very much, Frank. And of course, we really value this ongoing relationship and partnership we have with the CHT. Neil from CTO?
Thank you very much, Lisa, and the team at CARPHA, Dr. St. John. At the CTO, we actually have to say significantly thank you to CARPHA, because this area of health is definitely not our area. And having a partner in CARPHA who could step in at this point in time, keeping their eye on the ball at all times, answering our questions, and sometimes it has been very difficult. And we want to commend you for the excellent work in getting this tool, which has been some time in the making, up to grade to be able to deal with this specific pandemic. This pandemic has taught us that we can't find the answers alone. We have to collaborate, and we have to keep collaborating to ensure that we keep on top of the situations that are constantly changing and presenting themselves to us. So we want to, again, thank you, commend you, and we look forward to continuing working with CARPHA and all the partners to ensure that we keep this region safe for our residents and for people who are planning to come, people who are already here visiting from international markets. And we hope that actions like this one can be replicated across other sectors, because it is tourism and health as the groundwork, but we need to forge ahead in our collaborative work to ensure that tourism, which is a very significant part of the GDP of most countries, rebounds, so that we can work together to ensure the livelihoods of Caribbean citizens. So thank you again, and I wish everyone here the best of luck, and stay safe. Thanks.
Thank you very much, Neil. And again, we continue to work with CTU and CHT, in every step of the way, because this health and tourism partnership is really key as we reinstate travel back to the Caribbean in a healthier and safe manner. Just to wrap up, we will send a feedback survey to all participants who participated today through email, as well as all that we have said will be posted very soon by no later than Monday. So go on to carpha.org/THP and you'll be able to see all of the information, including the infographics and the videos that were posted. Please feel free to access any questions. We will answer them. And my closing remark is to get the app and get the stamp. Thank you very much. Stay safe.